Wow, that was just jam-packed with information. So thanks to Aisha and Javier and Meredith and Jim. And we do have time for questions. So if you could raise your hand, get a mic, and ask a question. Who's got a question?
Yes.
Hi, this is a question for Javier. This is Ella Auchincloss from Rethink Health. I was in the theme of perfection's the enemy of the good. I was really impressed with the perfect tax that didn't pass or failed, and then the less than perfect one that did. And I was wondering if he could say a bit more about how the strategic assessment was made regarding exactly where to target the tax, and how did that actually come to pass? Because I think it's those kinds of subtleties and those kinds of backroom conversations that a group like this could have we could really make some impact on.
So, how did we choose to target the tax? So, well, we knew we wanted. How did we know where we want? So, we had done some polling. Well, first we knew that there were 30 different attempts, and each one had tried it, this one way, and they had all failed. And so, we had done some local polling. When we did our initial polling, it came in that if the election was held, that day, that we would likely win at 66%. That was the 1 cent tax. And then, we knew that the beverage industry was going to come in very heavy, and I've got a whole other presentation that shows you how heavy they came into our little town. And we thought that was going to erode our margin, because at 66% we could have done, if we had one at 66%, we could have made it a specific tax, which meant that we could dictate where the money was going to go directly. But because we thought that the beverage industry was going to come in heavy, we decided to go down to 50%. And the way we would give our communities confidence that we were going to invest in the right places was by putting together this panel of experts to advise council. And so, it was political. There's economic perfect, there's public health perfect, and then there's political good. And every place, every locality is going to have a different political good. And so sometimes we just have to, I wouldn't say hold our nose, but we just have to be able to accept that in the political world, economic perfection isn't going to be there. And if the more we keep trying to push economic perfection, chances are that we're going to keep losing. So that's what I have to say.
Thank you. Please, Aisha, and then Michael.
Can you hear me okay? Yes, okay. Just to build on that theme of the political good, it's helpful not to think about earmarking these taxes as a one-for-one necessarily. For example, saying, okay, well, we're taxing sugary drinks, so we're putting money into obesity prevention. Philly is a good example where they taxed sugary drinks and said, well, you know what our big public health priority is? Pre-K, infrastructure improvements. So there's real opportunity to think creatively about what the community wants in a public health context and not necessarily look for it as like a one-for-one substitution.
So when I was doing like tobacco tax advocacy, the regressive issue always came up, and we had always countered it with, well, so are the diseases, and if it was alcohol, accidents, productivity, are regressive too, and are also on those populations that are using the product we were trying to tax. So does that not, I don't hear that being discussed now, or is that out of fashion, not effective? Do the economics not really work out? That the economic downsides of the piece we're trying to tax does not equal out? Or talk to me more about, because it used to be that it was always the industry use that regressive piece, and we were trying to counter it. So talk more about how it's being viewed today.
Can I respond? So, as a person of color, coming from a community that has higher than very high rates of diabetes, heart disease, stroke, I know that it's regressive, but if we know that the funding is going to come back into our community, especially if our communities are being held up as the reason why we're doing this, then we kind of feel used, because we've seen so often where these kinds politically, we've seen so often how these initiatives were used as a justification for why it needs to be done, and then when the rubber meets the road, or when the money comes out the ATM dispenser, it doesn't really make it into our communities. And so the other piece to this is having lobbied for this. This is practice project days. I used to be the executive director for Latino Coalition for a Healthy California. Lobbying on a state tax and going in to talk to our legislators of color, who mostly voted against this, same type of initiative at the state level. Diseases are aggressive. It just did not sit with them. It didn't sit with them. It becomes an issue of raw power, and going into the community and educating the community and mobilizing the community so that they could make the asks was a lot more impactful with those legislators than us coming in and saying, disease is regressive. So I don't know if I'm completely answering, but it's a political world. These taxes are a political world.
Thank you. Jim, did you want to also?
No, I just say that I think I agree, and in general, I think we think the benefits, the distribution of the benefits are sometimes harder to measure, but I think you're right in general, and it's just not always clear if that's a persuasive argument, but I think it's factually true. One important caveat is that's not clear that's true for carbon in the same way, except to the extent that carbon reductions end up also reducing other pollutants, which do have local impacts that are going to be distributed that way. It's not true necessarily for carbon otherwise.
Please.
And from a policy buy-in standpoint, I often find that some of the best ways to respond to industry bludgeons, like it's a grocery tax, it's going to hurt people of color, it's regressive, is to stop talking about those folks in theory and to actually get them to the table to speak for themselves and their own interests, and to combine community education with community partnership. And the reason I always try to put a fine point on partnership versus education is really a one-directional flow. I have something to say and I'm going to educate you. And partnership implies that while I have something to say, I have a lot I want to hear and learn about from you. And I think that helps so much take these vulnerable communities out of the realm of political football and re-empower them to articulate for themselves and determine for themselves.
Thank you. I think we're at time. One more question, please,
Okay.
and then
It's not an easy question, but I'll put it out there.
Oh, good. Not an easy question.
Maris Ash with Change Lab Solutions, work with Aisha. I want to put the issue of preemption back on the table and put it in a real politic context, which is when communities start becoming successful, because we can do the soda taxes at the local level, say in California and some of the other states. We see preemption by the industry overriding the local ability to for local control over outcomes. And so the role of community engagement can be helping to fight against the preemption, but it's very expensive, it's very time consuming, and the industry can move more quickly, always with more money than we in public health can put on the table. And how how can we best, we're seeing preemption as we learned about it first in tobacco control 30 years ago, and it's happening all the time. Public health is losing, by and large, this local initiative and engagement, and snowballing to statewide success because of the power of preemption and how organized industry is, not just on health, but on economic justice issues and other environmental justice issues, other priorities that we might share. Any thoughts about what we do about preemption, how we mobilize communities, the fact that we aren't going to have enough money in comparison? What strategies in a real politic way do we have to be paying attention to?
In 2 minutes.
I'll give a 30-second answer. You know, Meredith, I think, Maris, good to hear your voice. I think that if preemption were to happen, I think we've got 3 cities, at least 3 cities in Berkeley where folks work really, really hard, in California, where folks work really, really hard at the ballot level, legislative level, to get something passed. And I think that we need, at the state level, to be activating those groups and having them at the table on the discussions of how to combat preemption. We got to get the buy-in, because they're the ones that are going to come in, and they're the ones that will, hold the signs that we're going to need and talk to the legislators that we're going to need to. And I'll be honest, I keep hearing a lot of talk about preemption from a lot of the public health folks, but nobody's talked to me about it or how we could activate, groups that I work with. So it's an insular conversation so far that I've seen.
And actually, to that point, I think that's a really good notion to wrap up on, which is that we no longer have the luxury of being single-issue advocates. The public health folks can't be worried about preemption while not showing up for the economic justice issues. The economic justice folks can't be worried about their issues without showing up for racial justice, and so on and so forth. And I think it's by banding together these very sophisticated pockets of specialized advocates into a much broader coalition that we can effectively mobilize against preemption.
So please join me in thanking our wonderful panelists. And Alina, do you want to come up and tell folks what's next?
And I'm sorry, the time for lunch is a little bit short, but we can only provide lunch for the speakers and the members, but for the rest of you, there's a sheet with information in your packet about lunch places nearby, and many of you are local, so you'll know where to go. Sorry about that, and we'll see you at 1 o'clock. Thank you.